My name is Dr. Amy Newberry, and I'm the owner of Pelvic Prescription Physical Therapy and Wellness. And I started this company with the passion in order to create a modern, more up-to-date space for women to empower them and help them feel more confident in their bodies.
The first time I called, I was incredibly nervous. I had gone to doctor's appointments for years, had been dealing with issues since I was a young child. And so I was a bit jaded coming into the scenario. I had become used to walking into appointments and not necessarily feeling as heard as I would have liked to, and kind of not in control of my own care.
The most common misconception that does happen around pelvic floor therapy is that all these issues are normal. It's become very normalized in society to pee your pants. It's become very normalized to have pain with intercourse. So if you have any of those things, the number one thing to know is that it's not normal. It might be very common, but it's not a normal thing. And that's a sign that you need to get help with pelvic floor therapy.
Awkwardness of having your pelvic floor examined, and it was great.
I feel really supported working with Dr. Amy. It's definitely challenging and it's a commitment, but she is so transparent and I always know the expectation, and she's very accommodating with my schedule, and if I need to bring my kids, it's a safe place for them to come to while I'm working, and it's been such a positive experience.
So we always make sure that our clients feel comfortable telling us everything. And we do tell them nothing's TMI. We have heard it all, and we keep a very open conversation, and we'll ask them questions about possible things that they could be struggling with. And then if the potential client wants to work with us after that, then we'll explain our process about coming in for an evaluation to help them find answers to what they might be dealing with.
We only ever did things that I was comfortable with. The incorporation of some holistic methods were also something that I was hesitant of and a little skeptical of at first, but I've really come to start using them not just in reaction to my flare-ups and pain and discomfort I may be experiencing, but preventative as well.
I feel very alone, so that's why it's very important to me that we create community around this so that women don't feel alone in what they're struggling with.
My experience with pelvic prescription has been so wonderful. It's been a really positive experience. I'm physically feeling a lot better, and every appointment I feel like I get all of my questions answered, and it's free of judgment.
The culture here it's really awesome, to put it simply, but very warming. So you walk in the door and instantly feel welcomed and invited. I bring my baby to some of my sessions, so if you talk about a very welcoming culture, it's great because they just include him in my exercises and the things we're doing, like he's family. So I just feel, I don't know, it just feels like an extended family.
I am confident running, playing, and jumping with my babies.
I am confident in managing my flare-ups independently.
I am confident in wearing fitting clothes around my torso, and I no longer look pregnant.